Now let us discuss about various T-cell disorder that leads to the immunodeficiency. Those are the thymic aplasia, interleukin tubule receptor deficiency, autosomal dominant hyper IgE syndrome, which is also known as the Job syndrome, and chronic mucocutaneous candidiasis. These are the 4 T-cell disorder that eventually leads to the immunodeficiency in our body. First of all, let us talk about the thymic aplasia. The main defect in the thymic aplasia is that there is 22q11 microdeletion. There is failure to develop the third and fourth pharyngeal pouches, which leads to the absent thymus and parathyroid glands. So mainly what happens that third and fourth pharyngeal pouches gives to the thymus and parathyroid. So if there is failure to develop the third and fourth pharyngeal pouches, there will be the absence of the thymus and parathyroid glands. So there are mainly 2 syndrome that occurs in the thymic aplasia, that is disorders syndrome and velocardiofacial syndrome. In the disorders syndrome, we see the thymic and parathymic and the cardiac defect, whereas in the velocardiofacial syndrome, we see the palatal, facial and the cardiac defect. Now let us talk about the presentation of the thymic aplasia. In the thymic aplasia, we see the cardiac defects. There is conotruncal abnormalities, for example, tetralogy of Fallot or truncus arteriosus. We see the abnormal facies, thymic hypoplasia, which leads to the T-cell deficiency, and if there is T-cell deficiency, we see the recurrent viral and fungal infection. We can also see the cleft palate, hypocalcemia secondary to the parathyroid aplasia, which will ultimately lead to the tetany. So the findings in the thymic aplasia is that there is decreased amount of the T-cell, decreased amount of the parathyroid hormone, and decrease of the calcium. In the chest X-ray, we see the thymic shadow is the absent on the patient with the thymic aplasia. Now let us talk about the interleukin 12 receptor deficiency. So main defect in the interleukin 12 receptor deficiency is that there is decrease of Th1 response and it is autosomal recessive. The presentation in the interleukin 12 receptor deficiency is that there is disseminated mycobacterial and fungal infection. So it may present after the administration of the BCG vaccine. The findings in the interleukin 12 receptor deficiency is that there is decreased amount of interferon gamma. So the most common cause of the Mendelian susceptibility to mycobacterial disease is the interleukin 12 receptor deficiency. So going towards the autosomal dominant hyper IgE syndrome, which is also known as the Job syndrome. The main defect is that there is deficiency of the T helper 70 cells due to ST83 mutation, which leads to the impaired recruitment of the neutrophils to the site of infection. So the main presentation in this Job syndrome is that there is the cold, non-inflamed staphylococcal abscess, retained baby teeth, coarse facies, dermatological problems like eczema. There is increased amount of the IgE in the serum. There is the bone fracture from the minor trauma. The findings in the Job syndrome we see is that increased amount of the IgE, increased amount of the eosinophils. So these are the findings in the Job syndrome. Now let us talk about the chronic mucocutaneous candisiasis. So the main defect in the chronic mucocutaneous candidiasis is that there is T-cell dysfunction and impaired cell-mediated immunity against the Candida species, which is the classic form caused by the defect in the AIRE. So the presentation in this chronic mucocutaneous candidiasis is that there is persistent non-invasive Candida albicans infection of the skin and mucous membrane. So the findings in this candidiasis is that there is absent in vitro T-cell proliferation in response to Candida antigens, and there is also absent cutaneous reaction to the Candida antigens. So in this video, we just discuss about the various T-cell disorder which leads to the immunodeficiency. We discuss about the thymic aplasia, interleukin 12 receptor deficiency, autosomal dominant hyper IgE syndrome, which is also known as the Job syndrome, and chronic mucocutaneous candidiasis. I hope you understood this video on the immunodeficiency due to T-cell disorders. Thank you.